Welcome back, everyone, to Open Line. We have with us the Commissioner for the Tennessee Department of Health, Dr. Lisa Piercey, is joining us, and we're just going to go to the phones now. We have several calls. Let's go to Bill. Hello, Bill.
Yes, sir.
Go right ahead. What's on your mind?
Yes, this is Bill. How are you doing today, sir?
Doing well, doing well. What's on your mind?
Well, the one question I wanted to say that in my lifetime, the government in the United States have came out with a law that you can't smoke cigarettes in stores and public places and federal buildings and all because it's the secondhand
smoke. I think we just lost Bill. I'm not sure. You can call back, Bill, if you want. I'm not sure what you were going to say there, but okay, let's go to Russ. Hello, Russ.
Hello.
Go right ahead.
I'm wondering if it's safe to keep dental appointments, and I'm also wondering for my wife about hair salon. Thank you.
Thank you. We did see some early outbreaks coming from dental offices, but his question is it safe to keep dental visits? And he also asked about hair salons.
Hey, Russ. Yeah, I went to the dentist and the hairdresser last week. So it's safe to do so if you take appropriate precautions. Now, dentistry is a little bit more serious. I will admit that because when they're using those drills and polishers, it aerosolizes. So it puts the little tiny particles in the air. Many dentists are using, I'm not sure what the word is, air evacuators. They're almost like big vacuums that suck it in so you're not breathing in all of those aerosolized droplets. But it's perfectly safe to go to the dentist if you're feeling well, and you'll notice that they're taking a lot extra precautions. And I did just go to my dentist last Wednesday, and I encourage you to do the same and keep up with your dental health. As far as the hair salon, there is really good evidence that if both the hairdresser and the customer wear masks, that there is little to no transmission. In fact, one of the very early studies that came out, it's probably been a couple of months ago now, there were two hairdressers, I believe it was in Missouri, it wasn't too far away, who were both infected unknowingly, and they took care of a total of 134 clients, and both they and all the clients were masked, and none of the clients became infected. So that kind of helps us prove the point of how effective masks are. But if both the hairdresser and the client are wearing it, it's safe to go to the hairdresser too.
So go to the hairdresser, but wear a face mask. That's basically
right.
What you're saying there. Okay, let's go to Steve. Hello, Steve.
Yeah, hello. Thank you for taking my call.
Yes, sir. Go right ahead.
Yeah, Dr. Piercey, I got to say, from where I'm sitting, it seems more like, just like the administration in Washington, their main focus has been to downplay this from the start. That's what you guys are doing. It seems like it's more of a decision that's political instead of privacy.
So your question is, are they downplaying it, and is it political? So he feels like it's being downplayed, and he's asking you directly, is this political? Are you downplaying it? What do you say there?
Steve, I'm a doctor, and I'm here to give you health information. I have spent months now side by side with our governor and with our administration, and I can assure you we are all taking it excessively seriously. We are working on this all day, all night, and have been for almost 6 months now. We are committed to giving you the absolute most accurate and transparent information. When it's bad, we'll tell you it's bad, and when it's getting better, we'll tell you it's getting better. And so I approach the entire thing like a doctor-patient relationship. And in my mind, it might sound silly, I have 6.8 million patients in Tennessee, and I take it as my job as a doctor to tell you exactly what the facts are and what you need to do to stay safe and healthy, and that's what I try to do every day.
So when things like wearing a mask becomes politicized, how frustrating is that for you?
It's frustrating, and it's kind of fascinating. It's like, how can you take something that's not political at all? It's a piece of fabric and that you wear over your face. And as I mentioned earlier, it's something that we in the healthcare industry have been wearing for decades or centuries. When you take something like that and politicize it, it really just doesn't make sense to me as a physician. This is a health measure, just like washing your hands is not politicized. Face masks shouldn't be politicized either. They're just a tool that we use regardless of what side of the aisle you're on.
Have you been frustrated with Washington? Do you feel like it has been politicized at the federal level?
I don't know that it stems from the federal level. I think our country is very partisan, and whether we're dealing with this or potholes or any other issue, it seems that perhaps things can become politicized. I haven't seen that out of our federal partners, but I've certainly seen that out of our society, and I'm not sure that that's a productive way to look at things.
Okay, let's go to R. Lind, I believe. R. Lind. Is that right? Are you there? Arlinda. All right, go right ahead, Arlinda.
Arlinda. Yes, my question is, when you're at the press conference and someone's asking a question and everyone steps up to the microphone and using the same microphone, they're taking their mask off. Are you concerned about that? Speaking behind someone that has taken the mask off.
You're talking about those news conferences?
Yeah, the news conferences.
That are often,
everyone takes their mask off to speak into the same
microphone. And those are televised. Yeah. They're, yes, okay.
Yeah. Is there any concerns about that?
Any concern about that?
Well, Arlinda, I actually haven't been asked that question before, so I'm glad to answer that. Actually, what we know about transmission of the virus is it's in droplets, and droplets, even though that many of them are very small, they fall with gravity, so they fall down. Some of them can hang in the air, but many of them fall. And so what they don't do is they typically don't jump off the microphone back into your airway. I know that seems a little snarky, but they stay there, and as long as you're not touching or putting your mouth right on the microphone, you should be safe. Now, I will mention that we don't thankfully do it in press briefings, but singers who use microphones and put it very close to their lips, that would be something that would be concerning to me. But just taking the mask off and standing near but not touching the microphone is safe. However, I will say that when you're using a handheld microphone and lots of people are touching it or passing it around, that is a risk of transmission from a commonly held surface. And so sometimes in the room of those press briefings, I know you can't see back there, but people will sometimes wear gloves or hold the microphone with a paper towel, and that's a good idea if you're going to be sharing a microphone at church or in your workplace or whatever.
Okay, thank you, Arlinda. Let's go to Kathy. Hello, Kathy.
Yes, I've got a question. You're saying that the teachers are supposed to report, if they've been around them for 10 minutes, if they stayed 6 feet apart. Well, a teacher's got 20 to a classroom, 4 or 5 classes a day. How are they supposed to remember all of this?
Yeah, that's a good question.
That is a great question, Kathy. And, one of the things that schools are doing that you may have noticed is a little bit different is something called cohorting. And that is where they keep a smaller group of students together all day, and they kind of move together, whether that's to lunch or to recess or between classes, because as you rightly pointed out, in a traditional classroom or in a traditional school setting, particularly middle school and high school where they're changing classes, there's all kinds of configurations of kids moving in and out and different contacts. But one of the important things that schools are doing are cohorting, so they keep a group of kids together, and there are seating charts in all of the classrooms as well as the lunchroom or anywhere else they're going. That way, if a child becomes infected, you can very easily look at not only the travel pattern of the child, but who is around that child and who might be in contact. But that's an excellent question.
And you think it's just too early to know how this is going with schools? Are you encouraged, or it's just too early to know? I mean, Davidson County has decided not to go back to in-person learning, as I'm sure you're aware. But again, all these other counties around us are doing that, and they're going to cafeterias and they're changing in classrooms, and it just is kind of a remarkable thing. Do you feel like it's safe, or is this just a big experiment?
As a mother, I would not send my children somewhere if I didn't think it was safe. My children were there on the first day, and Lord willing, they'll be there every day that they're healthy. And something interesting that I've seen, I've actually heard Commissioner Schwinn in education talk about it. She said, Lisa, it's remarkable what these schools are doing. She said, if you go in it looks like one of the safest places you can go in, because there are the barriers and there are the masks and there are lots of encouragements for hand hygiene and hand sanitizer. And the children are lining up and not mixing and mingling in the halls by and large. I know we've seen some photos that would say otherwise from other states. But she said, I'm really encouraged by how even sometimes very young children are doing well. And she joked with me, but she's right. She said, I felt safer in schools than I did going to the grocery store. And I can understand that. And so while it's still, I think it's too early to tell in Tennessee, the schools that have started several weeks ago appear to be doing well by and large. But the time will tell. We will see in the next few weeks after all the schools have been in for several weeks.
We saw some photos from Friday night of football, which is huge, important. And there was not a lot of social distancing, not a lot of masks. Certainly football itself, there's a lot of contact. How concerned are you about Friday night, people being in close contact? Again, how important is wearing a mask? And can they play football? As a doctor, do you feel like they can tackle each other and truly be safe with that going on?
So let me address the spectators or the crowds first, and then I'll come to the players. All of the best laid plans only work if people follow the rules and comply. TSSAA and many schools have gone to extreme measures to have people spaced out and wear masks and doing everything right. But you still have to have willing participants and people who take personal responsibility to say, I know it's hot out here and I don't want to wear this mask on an August Friday night, but it's what I need to do. And I need to be cognizant of how far away or not I am from my neighbor. And so people have to take responsibility too. And so I will admit, old habits die hard. And we've all been going to football games for a long time and we get excited and people move around and we just have to remind ourselves we're trying to get back to normal, but this is not a normal time. And so we have to do it in the safest manner possible. Now, when you're talking about players, undoubtedly, contact sports are a higher risk activity. I will not sit here and tell you that it's just as safe as anything else, because it is at higher risk. But when done properly and when the athletes are healthy and when they take as many precautions as they can do it in the safest manner possible. But there again, it is higher risk and it is optional. And you've seen many athletes, particularly at the college level, opt to sit out for a season. That's a reasonable alternative if you don't feel safe doing that. And whether it's going to school or playing in sports, we think it's really important for parents to have a choice. And if they don't feel it's safe for their child to do it at that time, then we encourage them to take the choice to sit out for a year.
Okay, we have to take a break. I'm being told we have to take a break. So we'll take a break and come back and get to more calls. We have a bunch of calls. Take a break. Be back right after this.